Well, welcome to the fundamentals of Oral Appliance Therapy 101. Good afternoon and good morning. Thank you so much for carving out time during your lunch hour or maybe your coffee break if you're in the West Coast like myself. School is back in session. Believe it or not, summer is over and school is in. We are here today to learn a little bit more about oral appliance therapy. But before doing so, I'm going to begin by sharing a very high-level overview of GEM. For those of you that are familiar with GEM, this will be a quick refresher. And for those of you that aren't, this will be a great kickstart to introducing us to the point of contact here with our Professor Jon. So starting off things, GEM Health is virtual specialty care. You oftentimes might hear me interchangeably use GEM Health and GEM Sleep, and that's because GEM Sleep is our first pathway into obstructive sleep apnea. GEM Sleep offers an access point, a single access point, by standardizing an otherwise fragmented consumer experience. At GEM, we diagnose, we treat, and we provide ongoing support for our patients through their entire obstructive sleep apnea journey. And what this does is it positively impacts cost and outcomes. I now have the honor of introducing to you Dr. Jon Parker. Dr. Parker is a graduate of the University of Minnesota School of Dentistry. He has been caring for patients with snoring and sleep apnea for over 30 years. He is a co-founder of the Sleep Performance Institute. He's a diplomat of the American Board of Dental Sleep Medicine and the American Board of Orofacial Pain. He is a charter member of the AADSM and is a past president of the American Board of Dental Sleep Medicine. Dr. Parker is an adjunct clinical professor at Tufts University School of Dental Medicine. And finally, he lectures internationally on the role of dentists in treating snoring and obstructive sleep apnea. So based on those credentials, I think we are in great hands. And I'm going to turn it over to you, Dr. Parker.
Kelly, thank you so much for the kind introduction. It's a joy to be here today with you to share some information on obstructive sleep apnea and using oral appliances to manage it. But I wanted to start just by talking a bit about sleep in general. Since I started caring for patients with sleep issues, I've always held the belief, sleep better and be better. Be better in relationships, be better in work, be better at play, be a better athlete. Just be a better person, be better in your life. And because sleep has such an impact on every system in the body, and it's really, sleep is the time that our body rests and restores. So brain function and memory, toxins are cleared from the brain during sleep. The immune system is strengthened, so healing and restoration occurs in the tissues of the body. Our microbiome, which are the bacteria on the outside and inside of our bodies that are critical to our health, are balanced during sleep. Glucose and insulin are balanced to allow us to have energy during the day. Hormones, all the systems in the body really are impacted by sleep. Yet if you look at the National Sleep Foundation's survey on Americans, only 43% of Americans would say that they rarely or never get a good night's sleep. So their quality of sleep is poor. And 63% would say they're not getting enough sleep. I think the average adult is getting 6.5 hours of sleep or less. And when you look at snoring and sleep apnea, about a half to 2/3 of adults snore. And research is now showing that 23 to 26% of adults have sleep apnea. So these are huge problems. And as it relates to sleep apnea, one of the challenges is that only about 10 to 15% or 15 to 20% of people with sleep apnea have been diagnosed. So that means there's a huge population of people out there who are suffering from this problem, but have not gone through the process of getting it assessed or treated. And so that's really incumbent on us as practitioners to educate people and to get them moving to improve their health. So let me start out by just talking briefly about what sleep apnea is. Essentially, As we breathe in right now, air flows through our nose or mouth and down into our lungs. When we fall asleep at night, the tissues in the throat and in the mouth, all the tissues in the body essentially relax. And so the tongue and the soft palate and the uvula in the back of the throat will relax at night, and the airway starts to narrow. Now, in people without snoring or sleep apnea, the airway maintains itself at a level so you can breathe smoothly. But for people with sleep apnea or snoring, the airway narrows enough that it reduces the flow of air. And over time, the pressure in the airway builds until the airway closes off. The tongue is pulled back against the soft palate, the airway collapses, and now we're trying to breathe, but no air will pass. Well, the brain senses it and it sends a message to open the airway. And under pressure, there's a snort or just a movement, and the airway opens, and then people start snoring again. So that's the process that occurs when somebody has sleep apnea. Kellie, have you ever heard that before?
Yeah, I might have heard that once or twice, but I think all of us appreciate the definition of it for sure. And a lot of us can probably relate to it.
Yes. So the severity of apnea, as we look at it as health professionals, is impacted by the length of time that apnea occurs and how much the oxygen levels start to drop because you're not breathing. In addition, we separate out levels of apnea. And so 5 to 15 breathing events where the breathing either stops completely or partially, 5 to 15 events is mild sleep apnea. 15 to 30 events is moderate sleep apnea. And more than 30 events where you stop breathing partially or completely is considered severe sleep apnea. And people with sleep apnea will typically have, their sleep is restless. They'll snore with intermittent pauses. Their sleep is disrupted. It's fragmented. And when they wake up in the morning, they're not as refreshed. And they could be sleepy during the day. Their memory might be affected. Their mood is definitely affected. Their sex drive can be affected. They can have morning headaches. So those are the symptoms or the issues that people with sleep apnea can see. Some have more, some have less. And there are health consequences to this. There's a higher risk of heart attack, stroke, diabetes, cancer, Alzheimer's in people with sleep apnea because of the sleep disruption, because of the oxygen levels dropping. It also increases the rate of motor vehicle accidents because people are sleepier. They're not as alert. They don't react as quickly. And of course, it can impact relationships, as Kellie and I were just discussing. So what are the treatments available? I'm going to focus on oral appliance therapy, but most of you are aware of continuous positive airway pressure, which is usually termed CPAP. And CPAP is a great option. It blows air through a mask to keep the airway open. The challenge is that about 50% of people can tolerate CPAP. And then there are surgical procedures that are also available, some more effective than others. But I want to focus now on oral appliance therapy. So where are these devices indicated? Well, they're highly effective, and I'll talk about that in a minute, for heavy snoring or primary snoring for people who don't have sleep apnea. For mild to moderate sleep apnea, they're highly effective. For people with severe apnea, and we treat a lot of people with severe apnea in our office. These are people that have tried CPAP and couldn't tolerate it. They can be somewhat effective. Poor tolerance of CPAP, as I mentioned, failure of surgeries, or in people who say, well, I'll use my CPAP at home, but I travel a lot and I need something, going to remote areas where you can't plug it in, or you go to other countries where there's difficulties in getting electrical current. People want to take something simpler, and an appliance is very simple to take with them, or it can be used in combination with other treatments like CPAP. So what is an oral appliance and how does it work? Well, an oral appliance is let's see if I can, there we go. It's a device that fits over the upper and lower teeth And there we go. Wow.
There you go.
You know, this is the toughest part of the whole presentation, is showing you what it looks like. It's basically like an orthodontic retainer. It fits comfortably over the upper and lower teeth. It holds the jaw slightly forward and helps stabilize the jaw in that position, which opens the airway and allows smoother breathing. The concept is similar to if you were taught how to do CPR. One of the first things you do in CPR is move the jaw forward to open that airway so that people can breathe, or that you can help breathe for them. And that's what these devices do. They hold the jaw forward to allow you to breathe easily. They're relatively comfortable and easy to use. People typically adapt to them within 2 to 5 days. They're well tolerated. If you look at compliance of CPAP, I've already mentioned about 50% of the people using CPAP can tolerate it effectively, and that's using it. Tolerance means 4 hours a night for 5 days a week. Whereas with an oral appliance, it's much easier to use, more comfortable to use, and the compliance and tolerance is about 80 to 85% of people, and they'll use it 7 hours a night for 6 to 7 nights per week. An oral appliance, it's just simpler and it's easier to travel with and so on. If we look at the research data and the information on effectiveness of this, because you may be wondering, okay, how successful are these devices? Well, for primary snoring where you don't have apnea, 85 to 90% success. For mild sleep apnea, as I mentioned, 5 to 15 breathing events per hour, 70 to 80% success in those people. If a person has moderate sleep apnea, the success rate is about 60 to 70%. And if you have severe sleep apnea, where you have more than 30 breathing events an hour, it's about 40 to 60% success. Although I will say that most people will see improvement. When I'm talking about success, I'm talking about getting the apnea level down to normal and the symptoms are resolved. Some people may wonder about the over-the-counter devices that they see on the internet or on TV and how they compare. So over-the-counter devices are really they have much less success. If you look at the data on research studies comparing a custom-made device like the one I just showed you, or tried to show you, there we go, and an internet or over-the-counter device, the oral appliances that are custom-made are about 70 to 80% successful for mild to moderate sleep apnea, and the over-the-counter devices are about 30% successful. And the reason is that over-the-counter devices are not customized for the individual. So they're bulkier, they're not as retentive on the teeth, so they don't stay in place as well. And they have higher rates of side effects, soreness in the teeth or jaw, or other side effects. So they don't manage the problem as well. People struggle with them more. But I have a fair number of patients who will come in who say they've tried them just to see. The advantage is that they cost less, obviously. Although I will say that oral appliances that are custom made, generally, most people will have insurance coverage to reduce the cost out of pocket for a custom made device. So let's talk now about the steps to getting an oral appliance. What are the steps for seeing a dental sleep medicine dentist? Well, first of all, prior to seeing the dental sleep medicine dentist, it's important to have a sleep test confirming your diagnosis as to whether or not you have sleep apnea. And GEM Sleep, which Kellie talked about, is a virtual sleep clinic. So it's very simple and easy to get the testing done. And the testing units that they use, Kellie, you want to show us? There it is. Okay. That is a home sleep test, very simple to use. It's a one-time use. And the information from the sleep test is uploaded through the internet, through the interweb. And it's uploaded directly, and then a sleep medicine provider reviews it, and the results are sent to you, and then you have it available, and a sleep medicine provider's recommendation on treatment. The other option is to see a local sleep center, which can take likely 3 months or more to get an appointment, and then months more to get the testing done. So this is that is an alternative if you wanted to see somebody locally. Once you have the prescription from the sleep medicine provider, finding an experienced dental sleep medicine dentist, I think, is critical to the success of treatment. And so you can go, Jem will be having a network of dentists on board, but you can also go to the American Academy of Dental Sleep Medicine, aadsm.org, and they have a Find a Dentist section on their website. Once you go in to see the dental sleep medicine dentist, then you'll go through a comprehensive history and examination. They'll take x-rays of the jaw and airway. And then you'll sit down for a consultation with the dentist where they will basically lay out your sleep apnea problem and the options to treat it. They'll talk about oral appliance therapy. And in our office, we work with 10 different appliances, and we customize the appliance to each person's situation based on the patient's characteristics and the features of the appliance so that it will increase success and comfort of use for the patient. Once we have had that consultation with the patient and they decide they want to move forward, we will take impressions of the teeth using a digital camera, which basically takes pictures of the teeth in the mouth. And then we'll also do a digital a measurement of where we want the jaw position. We send that data off to the lab, and the appliance is custom made by the dental lab. And a few weeks later, the patient comes in, we deliver the appliance, we customize it and adjust it so it's comfortable, and we give instructions on use of the appliance. The patient takes it home and uses it at night. Generally, they will gradually advance the jaw position because all of these devices are adjustable. And so you can advance the jaw position to open the airway more over time. We will see them for a follow-up visit about 6 to 8 weeks later. And once you are comfortable and the symptoms are managed and it's working effectively, then we will send the patient back for a follow-up home sleep test. And again, very simple through Jem, just using email to send a message. The unit is sent out, you do the one test, it's uploaded, and you get the results and the recommendations from the sleep medicine provider. If everything's going well, then we see people for long-term follow-up after that. So that is a quick review of sort of information about oral appliance therapy, what they look like, and how it fits into the overall picture of managing sleep apnea.
Well, I think it's a true definition of oral appliance therapy 101. So thank you so much, Dr. Parker, for that. One thing I would like to mention is a big differentiator at Jem is our sleep coaches. And our sleep coaches are the direct lifeline to support that help our patients through their sleep apnea journey, before diagnosis, to understanding their diagnosis, to understanding their treatment options, and then supporting them to be adherent and compliant and ultimately seeing the results that they're expecting. Feeling better in the morning, feeling more refreshed, their bed partner not elbowing them. And one of the things I wanted to call out is this consultative role that our sleep coaches take. A lot of you might not even been aware that oral appliance therapy was a treatment option. A lot of our patients aren't. And that's what's so great about having a personalized sleep coach at Jem. They're going to discuss the results with you. They're going to understand your lifestyle, and they'll help you determine what the best treatment option is based on your clinical results and based on your lifestyle. So now, speaking of our Jem patients, I am excited to introduce to you Steve. Steve is a Jem sleep patient who has been successfully treating his obstructive sleep apnea, and he's going to share his story.
Yeah, thanks, Kelly. Yeah, happy to share my story, and I think Dr. Parker, a lot of what you were talking about resonated quite a lot with my journey. So if we go back, I think I've been kind of on this pursuit for better sleep for the last 3 years. I wear a couple wearables. So I've been tracking deep sleep, REM sleep, wake events, all that stuff. And I think if you hear a lot about what people are talking about sleep, they're all talking about kind of better sleep habits. Morning sunlight, don't eat close to bedtime, no screens, all that kind of stuff. And, I was going down that path, but I didn't see really a considerable increase or a decrease, in my wake events. I didn't see really great, increase in really kind of measurable, like restorative sleep. And then someone had introduced me to Gem Sleep, about kind of obstructive sleep apnea. And I'm like, well, I'm younger-ish, I'm fit. There's no way I have sleep apnea. And so, Gem made it very easy to, as Kelly was sharing, order the oral online the sleep test kit. It was delivered straight to my door. It was really easy to use, and as both of them mentioned, and when I woke up in the morning, the results were directly sent back to Gem. And I think even that same day, they provided my diagnosis, which, surprisingly to me, I had moderate sleep apnea. So I was right in that middle range that Dr. Parker was talking about. Yeah, I think I was waking up 16 times a night, which was, pretty shocking to me. And so, as they mentioned, there was a couple options they provided. One was the sleep apnea, or the at-home sleep apnea, where you wear the mask and it forces air into your mouth. I knew that wasn't going to work for my lifestyle. I travel, it just wasn't going to work. And so I was really interested in this oral device. And Gem actually recommended a local dentist that specializes in this. And so shortly after that, within a matter of a few days, I had an appointment. They did, all the pictures and kind of the analysis of, my jaw and my teeth. And then just a couple of weeks later, I had an oral appliance that I began wearing. And surprisingly, it took maybe a day or two to get used to, but I immediately saw like really good results. I think, first and foremost, I no longer snored. And then I would say, like the wake events, as you can see on the screen, saw a significant decrease. And I think, I noticed that right away. I've also been measuring and getting blood work done every 3 months. And one of the things that was also surprising to me is that my body over the course of the last few months also got better at producing, testosterone. So I'm a fit, active guy. And, that was pretty surprising and kind of a really positive benefit that I saw. And, I think as I continue along this journey, it's kind of opened my eyes to, what else is out there that's possible to continue kind of on my journey to better sleep. So yeah, as I mentioned, it's been a very seamless, kind of easy process. Gem's made it very easy. The oral appliance definitely has seen, remarkable kind of improvements in my quality of sleep, and, looking to continue this journey and see what else, is on this path. So.
Great. Thank you so much, Steve. And we really appreciate you sharing your story. And I'm sure there's a lot of individuals out in our classroom who can relate to a lot of things that you had mentioned. And speaking of the classmates in the classroom, we wanted to open up a few minutes for questions. Prior to opening it up to questions, our internal team did a little brain session, and we thought of a few frequently asked questions to get the conversations moving, and we'll pop them up here in just a minute. But if anyone in our audience has any questions you'd like us to address live, we're happy to do so as well. And so we are going to start with our first frequently asked question. Bianca? All right. The first question is how do you help a patient if their jaw is stiff or if they're complaining that the oral appliance makes it uncomfortable? And we're, of course, going to turn this over to Professor Jon Parker.
Well, so this is something that we see periodically. And the issue is in how the appliance is balanced. So everybody is a bit asymmetrical. And so the jaw system, it needs to be set up so it's balanced comfortably and properly for each person's situation. And that's where the expertise of the dentist is so important in getting this set up. And so if, I guess just to give you some reasonable expectations, it's normal to feel pressure on your teeth and tension in your jaw when you're using the appliance. It's not typical or normal to have aching or pain in your teeth or your jaw when you're using it. So if you do, then you need to get in touch with a dentist. They can modify the appliance. They can modify the fit so it's putting less pressure on teeth, and they can modify it so that the way your jaw is positioned in the device is balanced and comfortable for you. And once that's the case, it's like I tell patients, it's yesterday's news, and you continue moving forward, and typically it doesn't recur. So if we looked at all the people I've treated over the last many decades with these appliances, probably 10% would say, oh, I had an episode where my jaw was sore at some point. Usually it's earlier on, and then after that, they were fine once the appliance was fine-tuned. So it's a smaller percentage, but we do see it. But it is, most of the time, the dentist can resolve it.
Great, thank you. I think we have one or two more questions, and we have about 4 minutes left in class. The next question that we see here is, will an oral appliance device affect your bite, maybe short-term, long-term? Could you speak to that, Dr. Parker?
Sure. So in the morning, after you take the appliance out, your bite's going to feel funny because your jaw's been forward. So we have a brief exercise program that we have people do. And essentially, it's done while you're doing other things, in the shower, getting dressed, and so on. For 10 or 15 minutes, what we will have people do is, okay, let's see if I can do this now. This little device, wrong way. There we go.
There you go.
This little device. Okay, I'm going to show you. This is a real demo. You bite into it and hold and release.
Awesome.
This is live.
Yes.
Anyway. So you bite into it, you hold for a couple seconds, you release. It's really simple, but what it does is it guides your jaw back into position in the morning. It's a simple way to do it. I did it this morning. I probably had it in for 30 minutes because I was busy. I was shaving and getting dressed and so on. And by the time I was done, my bite felt solid and everything was fine. So, but that said, it is possible over time continuing to use it. And especially if you don't use that morning program, it's possible for your bite to change a little bit. So your dentist and the dental sleep medicine provider need to keep an eye on that and work with you on that. But it's really simple. People tend to comply quite well with it, and it works.
Wonderful. All right. Well, I think we are going to move into our closing statements now. And since we are in class, that means there might be a little homework for each of you. So with that, we've got different audience members participating in today's class. For those of you that are in class and you're interested for learning more about GEM for yourself, whether you're snoring, whether your bed partner is elbowing you, whether you've recognized you're gasping for air, you can find GEM at mygemsleep.com, and you can go through the experience just like Steve did. For those of you in the audience that are either dentist or dental sleep medicine providers, and you are interested in joining our high quality narrow network, you can reach out to me directly, and Bianca, who is our wizard behind the screen here, will share my contact information, and this will be added to our follow-up as well when we send out the recording of this presentation. And for those of you in class that are either an employer or an employee benefits broker or consultant, if you too are interested in learning more about GEM and promoting GEM as a benefit within your organization, you can also reach out directly to me through my email or telephone number, and we can get connected on what next steps look like. And with less than a minute to go, today I am going to officially say that class is dismissed, but not without saying a huge thank you to Professor Dr. Jon Parker and Steve, our GEM patient, for joining us. And everybody in class, thank you so much for taking notes and starting your school year out great with us here at GEM. Have a great day, everyone.
Thanks, Kelly. This was great. Good to see you,
Thank
Steve.
you.
Yep. Thank you.
Bye.
Bye-bye.